Hello, everybody. Welcome back to TWIG. TWIG stands for This Week in Global Health. This is your one-stop shop to keep you up to date on what's happening in the global health space. If you're watching this live right now, then we want you to interact with us, so please send your tweets, and you can send messages straight from our webpage. You might be watching this at our webpage. That's www.twigh, that's twig.org, or you could be watching this on Google+. In either event, please interact. Send us your thoughts, comments, criticisms, pontifications, anything you want. You may be watching this at some point in the future on YouTube. We still love you guys. And of course, we've got a podcast too now, so you might be listening to this on a podcast. So welcome to the show. Just a quick reminder, if you want to know the links to any of the URLs that we've talked about during the show, or any of the information that's given by any of the panelists, of course you can subscribe to our show notes, and we send those out as an email, and you get everything that you'd want. So that's very exciting. Right, before we carry on, oh, and by the way, you can subscribe to the show notes at our webpage. There's a little, one of the pages there you can do it. Right, let's jump right in. I'm going to ask the panelists each to introduce themselves and tell us a little bit about what they're going to talk about today. I'll start with myself. My name's Greg Martin. I'm going to talk a little bit about the WHO's response to the global, to the Ebola epidemic in West Africa. Next, I'm going to ask Jessica. Jessica, who are you? What are you going to talk about today?
Hi everyone, I'm Jessica Taff, and I'm coming to you from the Washington, D.C. metro area. Today I'm going to tell you about a paper that came out in Lancet Global Health recently on the geospatial analysis of malaria risk and intervention coverage in 6 African countries.
Okay, sounds very interesting. Next up, Chris. Chris, talk to us.
Hey everybody, I'm Chris Ronson. I am coming to you from San Francisco, California. And today I'm going to be covering some of the most up-to-date Ebola issues and articles in West Africa, as well as some international activity.
Thanks very much, Chris. And next up, Katie. Katie, tell us, who are you, where are you, and what are you going to tell us about tonight?
Hey everyone, my name is Katie Jackson, and I'm coming to you from Stockholm, Sweden. Today I'm going to talk to you about the World Health Summit that just occurred in Berlin. On a bit of a somber note, being from Ottawa myself, our thoughts are with the situation going on in Ottawa right now.
Yeah, of course, and we're thinking about the people there right now as well. Vanya, talk to us. What are you going to talk about tonight?
Hello everyone, my name is Vanya de la Fuente. I'm coming to you from Geneva, Switzerland, and today I'm going to be talking about a new initiative by UNAIDS, and I'm going to be giving a couple of updates about the Ebola issues in the European and US context.
Okay, and last but not least, Susan, talk to us. Who are you, where are you, and what are you going to talk about today?
Hi everybody, I'm Sulzan, and I'm talking to you from North Carolina, United States. On another note, very quick, the 3rd Annual Global Health Showcase featuring research of Duke students in global health is being held at Duke University today from 5 to 7 p.m. So if you're in the Triangle area, do have a look. And if you're an organization or university hosting an event or talk relevant to global health, we would love to know about it and share it with our viewers. Send us a tweet or an email, and we'll do that.
Excellent. And if you want to email us, you can email us at hello@twig.org. Right, let's jump right into the show. Jessica, over to you. Talk about global health research news. We're listening.
Absolutely. Happy to do so. So there was a study that came out in Lancet Global Health this month in which the authors conducted a geospatial and temporal analysis of malaria risk and intervention coverage in 6 African countries. And they used information that was collected in 2 demographic and health surveys. Now, this analysis mapped out and revealed the heterogeneity of malaria risk that had decreased, and also related that to intervention coverage among countries and specific regions within them. Now, this is really, really important because this type of analysis and information can better target malaria programs and resources to the right places. Now, these sorts of analyses, the geospatial and temporal, have also been done with other diseases like HIV. For instance, they are assessing infection risk and prevalence at the subnational level, and they evaluate this in how they can better allocate resources in those contexts. The analysis and approach has also been carried out for HIV in India and Nigeria, and now the U.S. government is promoting it as well, particularly in how PEPFAR will or will not prioritize scale-up in different geographic areas within those countries that are supported by this program.
Okay, interesting stuff. Thanks very much. That's actually fascinating. Right, I'm going to talk very briefly about the WHO and their response to the Ebola virus. There's been a lot of writing about this. We're not going to get into it in detail, but we will have a couple of links in the show notes for more information if you're interested. There was an interesting article in Bloomberg last week, and they kind of cited 3 reasons which they, in their opinion, why the WHO has failed. And I suppose maybe it's, we shouldn't be saying that they failed, but why there's this perceived failure on the part of the WHO to respond to the Ebola epidemic in a way that in a way that we perhaps wanted them to, or in a way that they perhaps should. The first is poor communication, the second is poor leadership, and the third is underfunding. And on the funding issue, I mean, it's quite interesting because in 2013, at the World Health Assembly, a decision was taken to cut the WHO's budget, the budget that is set aside to respond specifically to emergency situations. That budget was cut in half for the year 2014, right? A terribly unfortunate set of circumstances, and we have to wonder what may have happened had that budget not been cut in half. And we know, and we're going to talk about later in the show, the enormous amount of money that's getting poured into dealing with this epidemic at the moment. The other problem at the WHO is that 70 to 80% of the WHO's budget doesn't come from member states. It actually comes from donors who earmark those funds for very specific activities and projects. So the WHO doesn't actually have that much leeway as to what it is that it's going to do with its money. And I think that's kind of a big problem when something that's unprecedented happens. You know, they don't really have the space to kind of move in a way that they perhaps should have. Larry Gostin, and a lot of you will have seen him on my YouTube channel. I did an interview with him recently when he published his new book. He's the professor of global health at Georgetown University. He's been quoted as saying the WHO is suffering from a cultural stagnation and a failure boldly about problems and looking at itself as a technical agency rather than a global leader. Very interesting quote from Larry. Richard Horton, as most of you will know, is the editor of The Lancet. Richard has said, once the Ebola virus is contained, 2015 should be a moment to bring humbled nations together to reinvest in a WHO that still remains the only frontline institute designed to defeat health threats to global security. So another interesting quote from Richard. We're going to have links to all of this in the show notes. I'm not going to talk more about it now. We could talk about it for hours. We may have a little bit of discussion and kick this around a little bit later. If you've got thoughts, send them to us as a twig or an email or on our webpage. You can submit them. We want to hear what you think. We want this to be interactive, and we want you to feel part of this discussion. We're going to jump right.
Can I just interject for a moment? I just want to say that's really interesting. I'm glad that you point out that these global health leaders are speaking out on this, and I think that's really great that they're putting their opinions out. I kind of wish that they had done it earlier. You know, talking about the problems with WHO and what role it should take. It shouldn't take a global health catastrophe for them to speak up, but I'm glad that they finally are. So that's great.
Yeah, I think it's really interesting as well with all of this funding coming from separate countries. I was just at the World Health Summit, and it was quite political in the fact that each country wanted to stand up and say how much money they gave and how much they had pledged. And I think it's really hard when states take such a big action in these things and send their own people and their own medicines. Where does the WHO fit? I think it's an interesting period for global health.
Yeah, absolutely. I mean, look, this whole epidemic has been a big shock to everyone. It's been a big wake-up call, and I think the global health landscape will be certainly very different going forwards after this. I think we may land up having a very new kind of WHO in the future because of what we've seen happening over the last couple of months.
Yeah, definitely.
Right, we're going to jump right in. Vanya's going to talk to us about a UNAIDS initiative. Vanya.
That's right. So the UNAIDS just set up a new initiative that's planned to block the spread of HIV by 2020. So this initiative is basically going to try to get 90% of people living with HIV diagnosed by this time, 90% of people diagnosed with HIV to be on treatment with antiretroviral therapies, and 90% of the people on treatment to have durable viral suppression. Of course, this initiative is really ambitious, especially if we consider, so for example, some numbers from children. Only 1/4 of the 3 million children living with HIV actually accessed treatment in 2013. So of course, let's see if UNAIDS gets there by 2020.
Yeah, it is very interesting. And although it is the case that there's still a huge unmet need in terms of children being put on antiretrovirals at the moment, I mean, what we're seeing today is a huge improvement on what the case was about 5, 6, 7 years ago. You know, at that point in time, almost no children were getting put on treatment. Now, of course, that's different. And just a little bit of history as to how that changed. One of the big initiatives that was put in place to try and fix that was a partnership between UNAIDS. So UNAIDS is a funding agency that's embedded within the WHO, and their mandate is to provide funding for projects that impacts on the market dynamics for projects for products for HIV, TB, and malaria. So UNAIDS partnership with the Clinton Health Access Initiative, and they put aside about $500 million. specifically to address the price problem around antiretrovirals for children. And they did a few things. One of them was that they pooled the procurement across 40 countries. So instead of each country negotiating prices on their own with their small little budget with Big Pharma, we had 40 countries with one huge pooled budget going into a negotiation all at once with the pharmaceutical industry. And obviously that allowed them to have much more negotiating power. Prices came down. They did other things as well. They worked with the countries to try and ensure that demand forecasting was improved, quantification, et cetera, et cetera. All of these things impact on price ultimately. The price came down dramatically. It came down enough for it to be cheap enough for country budgets to take over the financing of ARVs for pediatrics. And so the UNAIDS project has come to an end, and countries have taken over the funding, and now we're seeing a lot more children getting treated. So I think that's a fantastic. Who's got the button on the applause? We can give a quick applause to the Clinton Health Access Initiative and UNAIDS. There you go. Thanks very much.
No, also it's really relevant because without early diagnosis and therapy early on, 80% of children actually die before their 5th birthday. So I think this initiative will bring those deaths down by quite a lot. So
that's right, and children now, if they put on treatment, they can they can live into adulthood, which I mean, it's an exciting time. Okay, thanks very much, Vanya. That was fantastic. Next up, Katie. Katie's going to talk about the World Health Summit. Katie, over to you.
Yeah, so as you said, I just returned from the World Health Summit that just took place in Berlin, and it is an international forum to further international cooperation for health and to devise solutions for the global health issues with an interdisciplinary approach. And a shout out to Ayman from UAEM for helping me put together this summary. It's a little difficult to attend all sessions at once. And what was really unique about this program and this World Health Summit this year was obviously the Ebola is taking over a lot of the discussions, and it has quite a political focus. So in its 6th edition, the 6 major global health issues that were addressed in this World Health Summit was Ebola, climate change and health, translational medicine, medical education, prevention, healthy cities and demographic change, and hearing loss and aging communities. So that kind of gives an overview of what the upcoming global health challenges are from these actors. And these actors were political people, academics, social perspectives, high-level policymakers, researchers, civil society, representatives, health advocates, and actually a lot of student organizations. So this edition especially was well visited by students and young professionals who were actively debating those major issues alongside all these actors. So EMSA Europe, UAEM, IFMSA, AMSA Europe, and also I was there representing the Global Health Next Generation Network. So this was a really good representation, strong amount of students and young professionals there, which I think is really needed in these times. I mean, especially, I know we come back to Ebola often, but all of these issues that I mentioned that are upcoming and that we're focused on, those are the issues of the future, and to have students and young professionals integrated into these conferences helps us learn about how we can handle situations and contribute to the conversations. That was really good as well.
Yeah, that's fantastic. It's good to see young people, students and young professionals involved. And one of the things that Katie's put together, which is really exciting, is Katie actually runs a small organization that puts young professionals and students in touch with mentors who can kind of like give them advice. Yeah. I mean, Katie, do you want to just give us a 30-second overview of that? We've talked about it before, but it's such an exciting venture, and I think this is a good time just to talk about that.
Yeah, unscheduled, perfect. Actually, it will be launched in a few weeks. So the program is called CSIH MentorNet, and that's CSIH MentorNet. And the website will be available in the show notes. But basically, what we aim to do was to bridge the gap in conferences where you have the older people who are used to seeing each other and experts, and the younger crowd that kind of doesn't really know where to turn. And we connect them through mentorship, and we facilitate the mentorship with educational modules.
Fantastic. And Katie, just reminded, this was your idea. You started this whole thing, is that right?
I was a part of a group, but I was in the inaugural year. So it was a bunch of us that stood around at a conference and said, like, we have to do something about this. Okay. And so we modeled it after a IFMSA, a medical student initiative, but we wanted it to include past medical students. So that program is no longer available, and we are now taking everyone from the health field and non-health field that would like to work in global health and get mentored.
Love it. I love it. Good stuff. Okay. Someone else had a comment. Someone's jumping in there. Did anyone want to say something there? No? No? Okay. Moving right along. Now, very often we do themed episodes. This week we're just doing a news roundup. We're looking at what's happening in the news, but it's impossible for us not to make a lot of what we talk about tonight Ebola. It's so current, it's happening, it's topical, it's important. So I'm going to ask Chris. Chris, can you jump in and give us a little bit more of an update? What's happening with the Ebola epidemic? What's current? What's new? What's important? Go, Chris.
Yeah. Absolutely. Thank you, Greg. So I'm going to cover a little bit of what's going on in West Africa, as well as some stuff I'm going to touch on in the European Union. It's a combination of hopeful and daunting news. Right now, we're going to start with the best. Nigeria has been declared Ebola-free and is being hailed as an... Yeah, I know.
Someone hit applause. Hit the applause button.
The country is being hailed as an amazing success story and an example for other countries seeking to contain and eradicate the disease, just based on the steps that they took, the fact that they declared it an emergency almost immediately, and that they were very proactive in addressing cases and seeking out the sources. We'll follow that up with a little bit of good news in Liberia, where in Liberia, the Ebola death toll is over 2,200 right now. Communities are reporting a decline in the number of dead Ebola-infected bodies being found. So in spite of this improvement, though, there's still a great need for assistance and humanitarian aid, and Liberian President Ellen Johnson Sirleaf has issued a letter urging the world to help continue supporting the fight as funding is coming in slower than anticipated. In our show notes, we also have a link to a site where you can watch her address the world and appeal to the global community as far as help and assistance in fighting Ebola.
Nice. Good.
Next up, some bad news. The people of Doctors Without Borders and Medicine Sans Frontiers and the Donga Ebola Management Center in the Guinean capital of Conakry are seeing a massive spike in Ebola cases. Most of them are coming from the Koya region, approximately 50 kilometers away, and they're raising serious concerns once again about the containment of the Ebola virus. Guinea was the first country to report Ebola and to date has registered nearly 1,500 cases. So for more on that situation, check out our link. It'll take you to an amazing website called Ebola Deeply that offers independent and up-to-date news on the Ebola epidemic in whole. Two more things real quick. The EU leaders could be considering pledging a goal of $1.3 billion for Ebola when they meet later this week. The foreign ministers of the European Union agree pretty unanimously that they not only need to send more European community health workers to assist on the ground, but also to increase funding to help make progress where we can. And last but not least, economic growth is continuing in African countries except for those stricken by Ebola. In response to this, the World Bank is mobilizing $400 million as a finance package to be given to the three countries. It'll go towards providing emergency response equipment, building field hospitals and treatment centers, as well as taking the countries in the proper direction for recovery by strengthening the healthcare system, including monitoring the outbreak. The funding will provide general budgetary support for these countries, as well as redirecting scarce resources to fight the virus. And if I could just add with one quick note, there was a talk done the other day between Partners in Health, Last Mile, like Raj Punjabi and Paul Farmer, and one of the things that Paul Farmer actually said was, you look at the situation in Sierra Leone, they have no staff, no stuff, no space, and no systems, and in order to have those, you need resources. So a big applaud to World Bank on focusing on sort of rebuilding the country from the inside out, working on the health systems and all of that, because that's where we really need to make progress in order to improve the situation in the countries.
Okay, nothing wrong with a little bit of wisdom from Paul Farmer. Everything he says seems to hit home. Thanks very much. That was fantastic. I'm going to ask Vanya. Vanya, will you jump in and talk to us a little bit about what's happening regarding Ebola outside of Africa?
Sure. I just wanted to give a couple of brief updates. So one coming from Spain, which is also good news. The Spanish nurse who was the first person known to have contracted Ebola virus disease outside of Africa was declared free of the disease on Tuesday.
Yay, good.
So that's
More
the first piece of news.
We're big on the applause today.
I've overdone that, haven't I?
Yeah. Wait, and the second piece of news.
You're Spanish, aren't you?
Exactly, I am.
Okay, right. So
yeah,
you should be particularly happy about that.
I am particularly happy, especially because it was all over the news, and I don't know, just the media kind of took over. I was alarming a bit too much, I guess, in certain parts of Spain. And so the second one is that,
if you don't mind, I want to just curious because, like, I mean, we have all the Ebola panic going on over here that, you know,
yeah.
And so that there is a similar panic going on in Europe as well.
Well, in Spain, it was mostly because so the kind of like the news coming from the Ministry of Health and other responsible officers in Spain came a bit late and weren't so clear. So I guess that raised panic as well.
And you guys had that big controversy with the putting down of the dog that was exposed.
And he was finally put down as well.
Yeah, I remember reading that as well.
Yeah.
What's the deal with it? I mean, do dogs carry Ebola? I don't think they do.
They do. They do. They found out they can get infected. They do. But I mean, my whole thing with that was, why couldn't they quarantine? I guess the answer was that they didn't have the resources to quarantine the dog or test or something like that. And so they just took the easier route.
Yeah, there is an article, Greg, that talks about that in Ebola endemic countries. They actually tested dogs, and dogs do carry antibodies to Ebola. So definitely.
I did not know that.
Yeah. And so the other piece of news that I wanted to talk about as well is the current panic situation that's happening in the U.S. that you just mentioned, Jessica. I'm just going to give a couple of examples. In Maine, for example, an elementary school put a teacher on leave just because she traveled to Dallas for a conference and stayed in a hotel that was 10 miles away from the hospital where the two nurses had contracted the virus. And just another example, in Georgia, a school district actually barred enrollment for students from Liberia, Sierra Leone, and Guinea unless they presented a doctor's clean bill of health. So we're seeing that there is an increased discrimination against West Africans and their relatives in the U.S., which I think is particularly alarming, and there has to be further discussion as to how we might be addressing these issues.
It is a little bit worrying. And in fact, there were two children from Rwanda who were somewhere in the States, I don't know where, but they were told not, I think this is the story, I think they were told not to come to school. These are two kind of Rwandan children. Now, there's no Ebola virus in Rwanda. And what kind of made me smile, but I don't know if Rwanda was responding to the story with the children, but Rwanda have now started screening Americans coming to Rwanda. So if you fly from the States,
we deserve that.
This is absolutely ridiculous. I think that's going on. And I mean, two things I want to mention is that these issues were getting talked about months ago. Like the potential for this to happen, that there would be a stigma against West Africans about this. And the other thing is that I read that the Liberian soccer players are also experiencing the same stigma, and they've been booed or experienced that at some of their games, which is it's really sad.
Yeah, absolutely. It's terrible.
That is really surprising because actually a recent study by Lancet actually shows that if no exit screening was done at the airports of last three countries battling Ebola, Guinea, Sierra Leone, and Liberia, then according to this paper, at least infected people would be flying out each month. So I would love to know what our viewers think about exit screenings and whether they would be useful in controlling global outbreak of Ebola.
Yeah, please tweet us your thoughts or email them. We want to hear from you.
Mm-hmm. And just briefly, there's a really interesting article that establishes a parallel between what the author terms as fear Ebola and the early AIDS epidemic. It will be provided in the show links in the show notes, and I think it might be worth taking a look.
Okay, brilliant. So the link to that will be in the show notes. Vanya, anything else about the Ebola epidemic and what's happening?
No, that's it for now. Maybe after the live. Yeah.
Okay, right. And we'll have an ongoing discussion when after there comes a point when the show, what we put on YouTube, stops, but the live show carries on, and we have some discussion and banter. So stick around for that. But before that, we're going to ask Susan. Susan, talk to us about flu.
Absolutely. So although Ebola has lately dominated the headlines, we are seeing the start of flu season, which typically lasts from October to April in Northern Hemisphere. And according to the CDC, between 5 to 20% of population in US contract flu annually. By the end of last week, influenza transmission has been widely reported in Guam, and local spread has been reported in the states of North Dakota, Florida, and New Hampshire. Interestingly, the initial symptoms of Ebola are very similar to flu. Ebola may kill if it spreads, but influenza is much more virulent and kills 23,000 to 30,000 people each year in just the United States. So talking about Ebola and talking about flu in the coming months, as the Ebola panic and flu season collides, getting a flu shot becomes even more important, not only to reduce the flu-related deaths across the world, but also to improve differential diagnosis for Ebola. Giving an interesting fact about that, Thomas Duncan, when he went to the hospital first, was actually diagnosed as having flu-like illnesses and turned back. So in the words of Joshua Epstein of Johns Hopkins School, anyone can help fight Ebola by getting a flu shot and helping clinicians improve Ebola's differential diagnosis. So, and I would love to know what our viewers think. Have they got their flu shot yet? Let us know with #OffTwig. Love to hear about that.
Okay, thanks very much, Suzanne. Now, if you're watching this live, stay with us. Don't go anywhere. We're going to have an ongoing discussion. If you've been tweeting us questions, we're going to address them now. And there's a couple of news items that we didn't really have time for, so we might jump into that now. If you're watching this on YouTube or you're listening to the podcast, this show is about to end. Thanks very much for watching. We love you guys. Come back next week, same time, same place. Until then, don't do drugs. Always do your best. Don't ever change. If you're in a certain demographic, always use a condom. Thanks very much. Take care.
We're getting all epidemiological with our advice now.
That's right.